Welcome to CISO Conversations, EU Data Regulations. As always, I'm your host, Kev Johnson. If you, like so many IT and security leaders out there, are seeking ways to navigate the new EU data regulations, you've come to the right place. We're serving you insights and best practices from leading experts on data security on how the rollout of multiple data regulations within the EU is putting everyone's minds to the test. Today, Nicolas Groh, Senior Manager and Field CTO, is joined by Anastasiya Kiseleva, a PhD researcher in law, health and technologist at the Vrije Universiteit, Brussel, John Noble, former non-executive director at NHS England, and Dr. Stefan Buttigieg, resident specialist in public health medicine at the Ministry for Health and Active Ageing in Malta. They discuss the evolution of data management in healthcare, focusing on the need for improved security alongside rapid digital transformation, the growing importance of cybersecurity in response to the pandemic, and the role of the European health data space in enabling secure and responsible data sharing in healthcare across the EU. We'll keep today's episode short, sweet, and to the point. Enjoy.
Hi everyone, thank you for joining us on this new edition of the Data Security Talk. Today's special will be focusing on healthcare with the new EHDS regulations coming out very soon. And with me today to discuss that hot topics we have Anastasiya, Stefan and John. I will let them introduce themselves in a minute and we will be having a conversation about the regulation. Anastasiya, if you please.
Good morning, everyone, and thank you very much for the invitation. I'm happy to be the part of the panel. A brief introduction about myself. I'm a researcher in law, health, and technologies. I focus on transparency of AI in healthcare, and I also active in different other areas, and one of them is the European health data space. I published several papers on the topic on legal issues and other issues, and they were cited and referenced by the European Parliament and the European Commission. I also external AI experts at the European Associations of Doctors in Social Security, and I'm affiliated with two universities because my research is interdisciplinary and international. So I'm affiliated with Vrije Universiteit, Brussel, and there I'm the part of Faculty of Law. And also I'm affiliated with CISO Paris University, where I'm the part of Faculty of Computer Science. And I'm also the active member of the Health and Aging Law Lab, which is also based at Vrije Universiteit, Brussel. So this is some words about myself. Thank you.
Thank you, Anastasiya. Stefan?
Hi everybody. So I'm Stefan Buttigieg. I'm a medical doctor by training, and I am currently working at the Ministry for Health in Malta as a resident specialist in public health medicine, but I spend most of my time working on digital health. And currently I am the manager of the National Contact Point on eHealth in Malta, where I'm focused on primary data use. But really and truly, I also spend a lot of time working as well in academia. I work with the European Public Health Association, where I'm the vice president of the digital health section. Also work with the World Federation. And also have the wonderful opportunity to lecture on digital health, social media and healthcare, and digital therapeutics. But most of all, I love implementing. So I'm very much involved in the day-to-day. I'm working as well on data visualization, data analytics, setting up data pipelines, and really and truly, inevitably, security is a parcel of my day-to-day work. Over to you, John.
Well, thank you very much. My name is John Noble. I'm delighted to be here. I want to say a big thank you to Rubrik for allowing me to be part of this excellent panel. For the last 5 years, I've been a non-executive director at NHS Digital, who look after the core IT systems for the UK National Health Service. About 1.2 million people log on every day onto that system. And I've recently moved across to NHS England, where I lead on cybersecurity for NHS England. Prior to joining that, I was a director at the UK's National Cybersecurity Centre. I led on incident management, dealt with just over 800 different cyber breaches, many of those in the healthcare space. And of course, and we'll come on to later, one of those in May 2014 was the attack, which impacted the UK and many others. And we'll talk a little bit more about that later on, I'm sure.
Unfortunately, yeah, we will. It's everywhere in the news. It's really across Europe and UK. We can see those breaches. I'm not going to say every day, but unfortunately, pretty much. So John, let me actually start with you. And you mentioned it. You have a few years of backgrounds during the past decade, and let's focus on the past decade. You mentioned 2014. I think it's really one of the rising spots where it all started to really ramp up to the point that we know today. How have you seen data management and the processes around it evolve, and what have been the key factor impacting that change?
So I think I'll just start with what I think a little bit of context, certainly from a UK point of view. I think that we're all aware that healthcare systems are under enormous pressure. Aging population, lots of treatments allowing people to live longer, that's great, but it adds to the pressure. And then, of course, on top of that, we have a pandemic. But what everybody, I think, is realizing is that data is critical to allowing the health services, wherever they are, to cope, whether it's in primary care directly for the patients or whether it's in secondary to do with the research element. It's vital. But there then becomes a very big but, is this has to be done in a way that is secure. And I think certainly, as we saw with the WannaCry attack in May 2014, is that healthcare organizations struggle to get the right balance between security, usability, and cost. And it was very clear from the WannaCry that there had been a real underinvestment in the digital infrastructure. Many legacy systems which were clearly vulnerable, in this case, Windows 7. So I think that was the start of realizing that if you're going to go and move forward with digital transformation, you really need to invest in the security side. I think the next really big change for this did come around with the pandemic. And certainly in the case of the National Health Service, we went from practically no use of video conferencing to 1.2 million people on Teams within 4 days. And we ended up with a completely different shaped infrastructure. And we started to join up pots of data, whether it was to understand who'd been vaccinated, whether it was to be able to go and make medical records available, for example, to ambulance drivers. So there was a dramatic change in the way that we were structured. However, if I'm brutally honest, we didn't necessarily match that quickly enough with the security side. And this was all, of course, at a time, and I'm sure we're going to explore this a bit more later, when we started to see, particularly from a criminal point of view, hostile actors really exploiting our greater dependency, whether it was in healthcare or anywhere. We were much more digitally dependent. So we've seen, of course, a rapid increase in the number of attacks against healthcare organizations. And I think what this is really exposed is a dilemma, which I'm sure we're going to go and explore, is that digital transformation really is so important, but it's dependent on retaining the trust of users. Clearly, this is highly sensitive data. Its loss would mean a major loss of data means that people will withdraw their support. So I think, getting that right, getting the right balance is something that organizations are really going to go and have to do. But I'll perhaps pause there and allow you to do whether there's anything more we want to go take from those first few comments.
No, and I think it makes a lot of sense. I mean, we did it first and ourselves. The COVID really changed
the way that people approach the I would say the entire thing. And I mean, data was critical before COVID, but COVID really put something on top of it. We had the same issue in France, where a lot of the people that were vaccinated in Paris were actually receiving text message and emails 6 months after, because someone hacked the whole system and they had to come clean because of GDPR. So it did really put something on top. Stefan, you mentioned that you're working on those data pipelines, so you're really living that firsthand. How did you see that evolution going? How did that impact your priorities? Did you actually have to switch completely what you were doing from before the pandemic to where we are now? And how do you actually show the value of those data pipelines?
So thanks, Nick, for that. Well, like one thing that I've realized is that before the pandemic, I was very much focused on digital health, like that digital health looks nice, great, it works, it's seamless. But because of the COVID-19 pandemic, I was roped into the response team, and really and truly the focus was about data management. So we had set up a full team, just focus on data management processes. So when you keep this in mind, like even the fact that the focus was on data management already was a step forward. Now, of course, because of all the questions that had to be asked, because of all the insights that we needed in a short period of time, then the focus was not anymore on let's make this digital health application look great and work perfectly, but it was more on making sure that the data goes from the right place to the right destination at the right speed. So it was this kind of approach which was changing. And even like my values opened me much, much more to the idea of not just the primary use of data, but also to the secondary use of data. And data it's much more following the idea of fair principles. That it is findable, it is accessible, it is interoperable, and it can be reused. So having these things in mind really drove forward the need to not just superficially understand data management, not just superficially say, so this has to be stored here, here, and there, but really understanding how to make everything work together, and that it is secure, not as an afterthought, but really by design. And I am lucky enough to come from Malta, which is is a small island, and small islands have their own challenges. It's an island like the UK as well, but it's much, much smaller in scale. But I believe that we have learned so much, and now even in fact, for example, even within our ministry, now there is even a part which is focused on digital health and a part which is focused on health data. So you're starting to see this evolution happening all around, even across the European Union. So now we have the idea of a designated digital health authority and a designated health data access body. So already we're starting to see this. Even, for example, locally, we have a public administration data strategy, and the idea of a chief data officer is now coming to the forefront. Now, I would even take that further and even focus on the idea of a chief information security officer, someone who is advocating. So this is something I think that we really need to evolve, and I really want to continue on what John said, that it's not just about data anymore. It's not about just advocating for data, but it's also about advocating for information security. So I think that is going to take us way ahead, especially when you keep in mind that in 2022, there were like 1,463 cyber attacks per week, and 76% were targeted towards healthcare. So this is a very relevant conversation, what we're having today. And I'm really looking forward to hearing from my colleagues who I believe are so insightful on this topic. Over.
Oh, I agree. I mean, I've totally lived it firsthand. I broke my foot, went to the hospital in France, and they gave me a piece of paper was like, what can you use the card? Oh, we have some like IT issues. I'm working for an IT company. What are you talking about? I was so much in pain. I just didn't realize at that time that they were actually in the middle of a cyber. So it didn't impact the whole thing. I went back home, well, cured-ish, because it took some time. But I just came to learn that they were under an attack 2 weeks after. And it took them months to actually bring the whole thing down. So yeah, it can impact all of us. And I think that it's just the beginning that the rest of the population is actually hearing or getting to know about the whole thing. But I also agree on what you say about that idea of data transfer. And I think that's a big part of EHDS. And Anastasiya, you've been actively working on EHDS. Can you actually explain us a bit how what we've seen, what John and Stefan explained, will actually influence that, and what will be the consequence of it?
Yeah, Nicolas, thank you for the question. Yeah, definitely there are a lot of complexities, and John and Stefan already explain a lot about them. And the regulators in Europe already realized that it's very important to make data usage controllable and responsible. So the core idea of the European health data space is to unleash the potential of data sharing, use and reuse across the EU among different member states and among different stakeholders, but in very controllable and secure way. And like we also all know the value of data. Healthcare and medical research have been always data-driven and empirically informed. And we can also say that health data are the blood running through the veins of the healthcare system. And every second, a lot of data is generated by doctors, nurses, pharmacists, and so on. So it's like to put the value of data into knowledge, we also need to facilitate data sharing, data usage, and reuse. But as also was discussed previously, this type of data is very sensitive, and we cannot just open the Pandora box of data sharing and to give it to everyone. So it needs to be done in a very secure way. And I see that the HDS, I believe so. I advocate for the HDS proposal usually, which is not very popular opinion. I usually advocate that it will provide the rules that an infrastructure for make data use and sharing possible, controllable, sustainable, and responsible. Possible because it will open also the data access to different stakeholders. And now we know that it's also in the hands of big IT companies, so it's not really equal the market. And through the EHDS, there will be also possibility for small and medium companies to access data, and this will also facilitate the research, innovations, in economic growth, and so on. Then the EHDS also provides the rules for data governance. It will say who can do what and how with data. And this is very important. And of course, this implies that the standards of data governance, of data security, of data quality will be substantially increased. And of course, it will also facilitate cross-border healthcare provision and research. And finally, the EHDS aims to make data sharing and use sustainable and responsible. The message here is that data should be not only the benefit of stakeholders, but also their responsibility. So there will be also increased requirements for data quality and data security. So overall, we should kind of also a bit change the approach to data. We need to give the possibilities to use it and share, also to bring the good for the society, but also to realize that we should be very careful and very responsible to use it. Thank you.
I agree. But how do you see or what do you see the organization needs? I mean, Stefan mentioned CISO, DPO. That makes a lot of sense. I mean, even if the most of the time those people exist in the organizations, in hospitals or in research centers, the roles may not be really defined. I think with EHS that may change. What do you think?
Well, with the EHS, a lot might be changed. It will actually shift the whole environment of data usage and so on. And I should probably describe a bit what's the EHS about, just briefly. So there will be two main pillars of the EHS. One is primary use and the other one is secondary use. Primary use will be a cross-border digital infrastructure called MyHealth.eu, which will connect member states and will give access for patients to their data across the EU. So you already mentioned that you were in France and they couldn't provide you the with the access to the system and so on, with the possibilities. So the idea is that, for example, a person living in France can go to Portugal and unfortunately get sick, and then needs to go to the hospital. And then the idea is that a doctor in Portugal will be able to access data files in France and also, for example, prescribe the necessary medicines and avoid, for example, allergy issues. This is the idea. But for companies, for healthcare organizations, of course, it means a lot of change. Very specific details, technical especially, is difficult also to say because there will be a lot of implementation acts on the technical level after the proposal is adopted. So we have time to prepare, but we also need to think about how to do it now. And so the main change will be that the electronic health record systems will be subject to mandatory self-certification. And this applies to healthcare organizations if they develop internally this type of systems, or to external providers. And they will subject to difficult essential common requirements on interoperability and security. And when we speak about security, there will be two levels of compliance. One is the current framework, the general framework in cybersecurity, which consists of NIST Directive and Cyber Resilience Act. So they will be subject to that part, and then also to specific rules to be developed by the European Commission after the proposal is adopted. So, of course, there will be kind of change for the organizations who deal with the electronic health record systems. There is also the secondary use, but I don't know, maybe we should also give the floor to some other speakers, or I can continue.
I think the primary use is what a lot of people will be concerned about, to be honest. I mean, the secondary use is, I think, key for research and being able to share that data in a appropriate form with the right security privilege, with data masking and anonymization and all that. And we can definitely talk about it. It's, I think, a big topic. Thank you very much, you three, for participating into those discussions. Much appreciated the opportunity to actually enlighten us, and we'll see you hopefully next year. Thank you very much.
Okay, folks, that wraps up today's episode of CISO Conversations, EU Data Regulations. For more insights on navigating data regulations, why not join us next time when Nicolas Groh continues his conversation with Anastasiya Kiseleva, John Noble and Dr. Stefan Buttigieg about the new regulations in the healthcare industry regarding data security. Rubrik is on a mission to secure the world's data. We help organisations uphold data integrity, deliver data availability that withstands adverse conditions, continuously monitors data risks and threats, and recover their data when they're attacked. Make sure to hit the subscribe button so you don't miss out on future episodes. I'll see you next time.